My name is Scarlett Lawson. I'm a Maryville University student for the Nurse Practitioner program. I'll be performing an abdominal assessment on my patient, Travis. Hello, Travis. How are you today?
Okay.
Great. I'm going to be performing an abdominal assessment, so let's go. So I'm first inspecting Travis's abdominal area. So I note the color. It's pink in color. He has tan skin. So his abdominal muscles, he is symmetric. I do see slight bulge in the middle upper abdominal quadrant. Travis did tell me that his doctor told us that he did have a couple of hernias in the abdominal area. So throughout our assessment, we'll be talking about those as well. Also know by inspection, I see the abdominal muscles having normal separation. Again, that's an expected finding. Also, I don't see any skin issues or conditions. I see no rashes or no areas like that at all, which again is a normal assessment. I'm looking again for masses. I don't see any abdominal masses. Again, I see the bulging area, if you can see this, which should be consistent of the hernia. So we've also got to assess for the venous return pattern. And what we're going to do here, look in the abdominal area for a vein. So if you don't mind to move your arms for me. So I see in this area, there are some veins, and I'm going to assess that venous pattern. And I'm going to have time, how long it takes to see that return of blood. So for my assessment, the venous return to the abdominal area was, the way from umbilicus was the one that was actually the normal. Again, that was quicker. So that's a normal expected finding. Now, with auscultation, we'll listen to Travis's abdomen. We'll listen to all four quadrants, starting in the top upper left quadrant. Just breathe normally for me. So upon abdominal auscultation, I did notice these were all expected findings. I did not hear any tingling sounds or possibly too much fluid in his abdominal area. I did notice within that 60 seconds of listening that Travis did have 5 to maybe possibly 10 or so abdominal clicks and gurgles. Again, that's a normal expected finding. There were irregular pattern, which again is normal. So I didn't see Travis showing any abdominal accessory muscle use, so which would indicate some type of respiratory issue. Again, these are all expected findings. I'm going to also listen to the arteries of the abdominal area, the abdominal aorta. We're also going to listen to the renal arteries, the iliac arteries, and the femoral. The femoral, for this assessment, technically I will not show the femoral area for the school purposes. In a normal assessment, I would do so. They are located in this area. Okay, so we're going to first start out with the abdominal aorta, which again is above the umbilicus. I'm listening for any bruise, which would be an abnormal finding. Okay, so my next area I'll be listening to are going to be our renal arteries. Next, we'll be listening to the iliac arteries. On both sides. And again, like we would say, if it wasn't for school purposes, in real life, we would be listening to the femoral arteries located towards the bottom of the groin area. So I did not hear any bruise. Again, that is a normal finding for Travis. Next, we're going to move on to percussion. We are going to percuss all four quadrants of the abdominal area, starting at the left upper quadrant. We're going to see if we notice tympany, which is a normal expected finding. So we're going to go ahead and I'm going to percuss this area, okay? Next. Looks to me, the tympany was noted in all four quadrants. Again, it's a normal finding. I'm going to also percuss the liver in the right upper quadrant. Okay, we're going to move on. We're going to percuss the spleen. Now, with percussing the liver, we're going to start moving from the downward area upward. So I'm going to find an area of tympany to an area up to dull, which a dull would indicate an actual organ, which would be our liver. We're also going to measure that. So I know the area of dullness, I'm going to mark that. Now we're going to move from top to bottom, so into the intercostal spaces up here of his chest until we feel dullness. Okay, so my area changed here. So I've marked those areas. Approximately with percussing the liver, notice possibly there was about 8 centimeter distance there. So that would kind of be the outer line there, again, of his liver. Again, it's a normal finding from that 5th intercostal area here. So we're going to percuss the spleen, which is the left upper quadrant. So our left upper quadrant, this again would indicate if there's any issues with the spleen. With our percussion, we're going to start with, when we do the percussion of the spleen, we're going to look from the tympany to dullness. Again, the dullness indicates that there's an organ there. So we're going to go from top down. Okay. So now, if you did notice, Travis shows some grimacing. I hear him kind of make just a very uncomfortable sound when I'm actually percussing that. So that would indicate there's a possible problem with our left upper quadrant where the spleen is located. So that again would lead on to further investigations about possibly a splenic issue. Again, he has been assessed for a spleen issue. He's still waiting for results to be pending. So this assessment is right for Travis. So again, I would mark that as a note that there's an issue with his spleen. And again, we would further investigate that. So, like I said, now what we would move on to, and I did notice, of course, in that area, there was dullness where the spleen would be located. We're going to move on to the gastric bubble. That area is the left lower anterior rib cage and the left epigastric region. So we're going to look at this area, and this area where the gastric bubble should be located will be lower in intensity as opposed to the intestinal area with their tympany. So that's a normal expected finding. So we're going to kind of look around here where we would assume the gastric bubble would be. I noticed Travis is having some discomfort. So that did change. So that was good. Again, that is a normal expected finding for a gastric bubble area to be a little bit different in our intensity, a little bit lower. So we're going to move on to some light palpation. Travis, I'm going to have you lay down for me. Now, with our palpation, this area kind of helps to assess if there's any muscular resistance, kind of to see when I'm assessing this area. Travis, this could be uncomfortable for you since we did notice with our percussion that we were having some pain, okay? So bear with us. So we're going to start in our left abdominal area, our left upper quadrant, and I'm going to just slightly palpate. Just lightly. I don't notice any muscle resistance. These are all expected normal findings. So we're going to, was there any pain, Travis, or discomfort with that?
Not really.
Okay. Now we're going to move on to deep palpation. This may be a possibly painful assessment, but we're going to do this as quickly as we can. I'm going to start in the left upper quadrant, and this is usually where the spleen is located, so I'm expecting this to be painful, but we'll see what we're finding. So in this area, we're going to press down. Again, he shows some grimacing. His abdominal muscles are tensing here. So I know this area is possibly inflamed, possible splenic issue. Okay, so we would of course make a note of that and further investigate. We're going to move on to the right upper quadrant, which is where our liver, border of our liver is located. So with the right upper quadrant, we're going to palpate in an upward position. No verbal or grimacing, which is normal. Okay. Any pain, Travis? Great. So our gallbladder is supposed to be non-palpable. The spleen was supposed to be non-palpable. I can feel some slight, like I can slightly feel the spleen. So again, this is an abnormal finding. Our gallbladder is in this area, on the right upper. It should be non-palpable, and again, it's non-palpable. So that's a normal finding. And again, Travis, is there any pain? Great. So we're going to also do what's called a tuck your chin to your chest, and we're going to have you lift your shoulders and keep your arms at side. And this we're going to see if there's any bulges in our abdominal area. This can assess for possible hernias. This can also assess if there's any issues with masses. So I'm going to have you tuck your chin to your chest, raise your shoulders slightly off the bed. Okay. Now this again gives us our abdominal muscle tensing. In a small person like Travis, you could notice this bulged area in the mid-abdominal upper quadrant areas, and this is indicative of a hernia. He has 2 small areas in his upper quadrant. So this concludes, Travis, you can actually see if you can stand up for me, or sit up for me as well. Now what we're going to have you do, I'm going to assess your kidneys to see if you possibly have a kidney infection. Your kidneys should be non-palpable. But we're going to assess the C. So have you sit there on the side of the bed for me, and your kidneys are going to be right in this area. So we're going to see left hand side as well. We're going to palpate this area. This is going to be right on our our costovertebral. Okay, here we go. I don't feel the kidneys, which is again normal finding. Okay. Sit up straight for me. Turn this side. I'm sorry. The right side. Is there any pain? Okay. Have you turned your back a little bit towards the camera? Great. Now we're going to use kind of our fist, slightly, mildly tap in that area to see if there's any possible indication of pain. Does that hurt? Great. Good. Okay, that concludes our abdominal assessment of Travis. We appreciate your time. I hope you've learned something from our video, and thank you for watching.